Our next speaker today then is Jef Hooyberghs, and he is Head of Strategic Research at the Sustainable Health Unit at VITO. And VITO is an independent Flemish research organisation in the area of clean tech and sustainable development. Jef, I will hand over to you now for your presentation.
Thank you, SAPHIRE. I'll first try to share my screen. All right. Are you able to see the PDF?
Yes.
Yes.
Thanks.
Okay, thank you. Thank you for the opportunity to present the work here, which is about a personal data management platform, which is currently under development in the context of smart specialization, within the smart specialization of personal health. This is one of the reference topics in this S3 initiative. And this reference topic is being developed together with 3 regions, which is the region of Northern Ostrobotnia, where the Oulu University is the main partner, the region of East Netherlands, where the University of Twente is the main partner, and the region of Flanders, which I represent by VITO. My presentation is on the 4 topics that I present here, so I'll briefly try to explain the concept, the platform, the governance model that we're developing, and the regional actions that are ongoing. Like it was mentioned in the previous presentations already, there are some transitions going on in our society that are pushing things in a certain direction. And we are talking here about the interface between data and health. When you're talking about health, there is a clear transition towards a more personalized approach. And when you're talking about data and health, transition as citizen empowerment. Joanna already mentioned this very explicitly. We also believe that this is something we should anticipate on. And when you're talking about data, there is a clear transition from a more closed approach to data towards a more open and trusted ecosystem about sharing data. So starting from these transitions, we started to think about how things can be organized, especially in the context of prevention, because that is one of our key topics. How can we make sure that data that is needed to perform a personalized approach to our prevention, how can this data be organized? And that is why we are currently working together with these 3 partners on what we call the VR ecosystem. And this concept starts from the idea that data, personal health data, should be in the hands of the citizen when you are expecting engagement, when you're expecting empowerment of the citizen. That means that we have a platform where each citizen can manage his own personal data, which means that when data is created, and more data is created by citizens themselves, this was already mentioned today also, that when data is created in some way, that this data or a copy of it should also be stored within this personal data vault. When this data is available to the citizen and they are organized together, then you have a very powerful tool to feed research and innovation. That means that when this data is now at a crossroad where it is natural, meaning that different types of data are stored by the citizens themselves, you get a natural enrichment of this health data. And this rich health data can then be accessed by innovators to do research and development. This can be different stakeholders. Of course, the idea is here that since the citizen is in the center of this approach, that this is via a consent, and that the citizen is also involved in the follow-up of what is going on with this data. One of our partners, and I'll come back to this point later, clearly showed that the altruism or the engagement of citizens can be very high when there is a clear, transparent system behind it. Then the next step, which I think is also important to mention, is that when these innovations lead to new products and services, personalized product and services. These can be delivered to the citizen without the need of managing the personal data itself. That means that there can be a separation of data management, data storage, and the provided service and products. And when you separate this, you also create a level playing field for new innovators. This means that every innovator, small or large, has the same way of accessing the data and providing services to citizens. So this is also quite important, we think, for from the innovative perspective of the story. And then, of course, the final point that I want to stress here is that it is very crucial that there should be a governance system behind this concept to make collective actions possible and also to support citizens that are involved in the concept, in the platform. That means that the values that we are presenting here are very important to create the needed trust for citizens to engage and to share their data in a ethically correct way. This platform is what we call the VR platform. And this brings me to the next point. The technology that we're using to make this possible is the solid technology. This technology was developed at MIT in a movement to decentralize the data on the internet. That means that this technology was devised to make users of it, to give users of it the possibility to control their own data, to move their data, to connect their data to apps in the way that they want to, and to connect to other people if they want to with this data. This technique of this technology better was developed for the internet, but is very well suited to be used in this kind of an approach also. This is also supported by the Flemish government. Then the third point, which is about the governance model. Since the topic of today was also about smart specialization, I think it is important to mention that we applied in 2019 for a technical assistance facility support, which we received, and from the European Union we received expert advice on possible governance models for this approach. I think I can advise everybody to try to make use of this service in the context of smart specialization. This has recently been disclosed, this technical assistance facility support, and now we are in the stage where we can move to the next step, and that is to think about business models for the platform and for applications. And in the next year, in 2021, we will be doing an interregional co-creation session with stakeholders' involvement from the quadruple helix. This will have a focus on Flanders. It is also supported by the Flemish government. And it is important to mention here that this is in close collaboration with the two other regions in order to learn what we see in Flanders, whether this is also relevant in the other regions, and to get feedback from them, to see what can be transferred, what cannot be transferred, and how in a later stage scaling up can be achieved, because scaling up is of course very crucial when you talk about data-driven approaches and personalized prevention. That brings me to the final point, which is about the regional actions that are currently going on. Here I will focus on what is going on within Flanders. There is currently a partnership that recently was formalized between the partners that you see here. I'll briefly run over it. The first one is Domus Medica, which are the medical practitioners. So this is the first line healthcare. Zorgnet Icuro, which is the hospitals and the care sector. Vito as a knowledge institute. There is Vlaams Patiëntenplatform, which is the collection of all the Flemish patient organizations. This is a platform that covers, I think, about 100 patient organizations within Flanders. And there is the Koning Boudewijn Stichting, which is an institute that has a focus on the citizen, the non-organized citizen, and a common interest. So there is a lot of knowledge on different fields that has been brought together in this partnership here. It's also important to mention that all these partners have a quite extended trajectory when it comes down to the use of data within health and how to do this. And this year was reached a point where we all agreed about the concept that I just described in the previous slides. So within these partnerships, there are a lot of projects currently going on and are ready to start. In the next slide, I'll try to explain one of them. This project has been recently sponsored by Agentschap Innoveren en Ondernemen from Flanders. And it's about how to leave home safely in a COVID context. We already had a project going on together with Domus Medica, so with the first line healthcare, about the gezondheidsgids. This project was about a questionnaire that citizens can fill in. And based on this questionnaire, you can get evidence-based preventive advice. This concept is digitized currently and is built on this VR concept. This means that when this project is operational, people will have this questionnaire data available. This questionnaire data gives you a rough digital profile about your personal health situation. And then the idea with this new project is that this data, with consent of the citizen, can be used to give advice on how to leave your home in a safe way. Because this is currently an issue. We are advised to stay at home for the control of the pandemic. Well, to be more precise, we are advised to limit the number of contacts. But the consequence is indeed that people are leaving home they're leaving home not enough, which has a big impact on their health, and that is why with this kind of an approach, we are motivating people to leave home again in a safe way, and that is important to mention, to use the regional possibilities for instance, sport and recreation. So this personal data is also connected with the regional possibilities that are possible to do exercising in your environment, for instance. And that is where we are also very keen on connecting with the smart specialization platform on sports, because I think that reaching out to other sectors is something that needs to be done when you're talking about prevention and about health. That is the presentation that I wanted to share with you. Thank you. I will close it down now.
Yeah, thanks a lot, Jef. I had a question. What would be your tips other regions that want to build a successful interregional collaboration?
I'm sorry, the connection was...
Yes.
Can you please repeat it?
Yeah. What would be your tips for the other regions that want to build a successful interregional collaboration?
Yeah. I think a lot of things were already mentioned. Interoperability will be very important, I believe. So when you want to collaborate with other regions, one of the reasons is scale, of course. That means that when you want to do data-driven healthcare approaches, you need scale and you need to be interoperable with the other regions. So that means that on a technical level and on the legal level, this should be aligned. That's one of the very important things. And the other thing is that by collaborating with other regions, you also tap into the knowledge of the local ecosystems. And I believe that connection with local ecosystems is very crucial. And that is where we can learn a lot from each other, I believe. Things that are working very well in the local environment of Flanders might be inspiring to other regions, or might perhaps not be relevant to other regions, but sharing this information, I think, is very crucial. That is not just about science, but about how things work in the local environment.
Yeah. We have a question. Have you implemented the FAIR principles?
Yes, of course, and it is not different from any other approach on data. When you want to do new data approaches, the FAIR principles are the first thing that you should take into account. Yeah.
Yeah, for sure, but sometimes you never know if they are forgotten. So, and on your platform, how can other case studies or use cases or projects how can be implemented in your platform?
Well, first of all, this is what we want to study next year. We want to do a big co-creation session about how, and especially how business models can be used to tap into this system. So it's one of the important points, because tapping into it also means that you have to think about the business model behind it. And from a technical point of view, the solid ecosystem is, especially within Flanders, quite rapidly growing. And this technology should make it possible to tap into this ecosystem from a technical point of view.
Yeah. I had also a question. So you are working with a region in Finland. So I guess you are working in English, but to have the citizen engaged, you have to work in the local language.
That is correct. And I have to be honest that in the pilot project that we are currently running, they are still within the region where they are developed, and they are in the language of the local environment at this moment. But indeed, it is a challenge when you want to transfer this to others, how to organize this. And I think it is not just about about language, but also about ontology. So there is still a lot of work to do about how to deal with these problems. I agree.
Yeah, because if it becomes a good practice, other regions could use it, but indeed they have to have the possibility to use it in their local language.
Yeah, that's correct.
So yeah, Flanders is not at all region where we have a remote or sparsely populated region, but in Finland they have. Do you work also on this specific group?
To be honest, we didn't run into problems on this issue, but it is probably also because we are focusing more on the prevention side of the story, where the connection with the local offerings are very important, but we are not talking about huge infrastructure that is needed to make this possible. I mentioned the example where you want to do local recreation or sports. This is not really a big issue whether you are in a city environment or in a sparsely populated environment. So these problems are less pronounced, I think, in the pilot project that we are currently running.
Okay, well, thanks a lot. So now we